Hey, Dr. Timothy Harcourt here, third generation chiropractic physician. We're going to go over the Graston Technique today. So we're back with you talking about the Graston Technique, and we're looking at the front of the shoulder here. You know, there's tendons that many times are affected in the shoulder that cause shoulder pain. But fortunately, 98% of the shoulder tears are not complete. So that means that they probably will respond well to Graston Technique. But how does it actually work when we do it? When we stimulate the tendon with the tool, it stimulates the body to heal that tendon by ridding the acids off of the tendon. There is actually a glue that sets up inside the tendon, either the supraspinatus, infraspinatus, or the other tendons we mentioned. And that just acts as an irritant. And unless we scrape that off and allow the body to heal, you can take all the anti-inflammatories you want and it won't get rid of the problem generally. Each tool is made for a different body part. There's several tools that we use. In the shoulder, a lot of times we'll use the GT4, and what we will do actually is we will stimulate the tissue by coming through the skin, and we will sometimes do cross friction type of approach, and then other times we'll go along the length of the tendon. Now, when we do that, regardless of where it is, if you actually have a problem there, you're going to definitely feel it. One of the benefits of that is that you know we're hitting the spot. I like to say that if I'm a half a mile away from where the problem is, it's actually not going to help you. Same thing with the surgeon. If he cuts the wrong body part out, it probably isn't going to help you much. If we were to show a lower back, you could see that if we stimulated the muscles of the back in this respect, how that would be very comfortable for the patient. Somebody with a carpal tunnel syndrome will come in on the transverse carpal ligament, and will actually stimulate that ligament and give more room for the median nerve, which typically innervates this finger, and this area here. If somebody has tennis elbow, we can get in on this area real nicely with this one, and then we might come in with the general tool and get right in on that insertion into the radial head. The main takeaway about Graston Technique is that, first of all, it's non-invasive, it's non-surgical, it's non-addictive, and it's also directly to the body part that needs attention. The next thing about Graston is you will feel a difference right away. It's a beautiful thing. So as soon as we do the Graston Technique, before you leave the office, you are going to see a difference.